Hi, everyone. Happy New Year. Good to see everyone in this new year. Thank you for joining us for this first webinar of 2024. We're hoping to have many more as the year progresses. So Lindo has already mentioned part of what we'll be doing, and I just wanted to start by introducing our presenter for today, who's Anupam. So Anupam is a seasoned impact evaluation enthusiast with over 17 years of experience in various critical areas. These areas include women's agency, migration, maternal and child health, education, reproductive health, which Lindo hinted at already, livelihoods, and HIV/AIDS, mostly within India. She's proficient in designing, monitoring, evaluation, and learning frameworks, and conducting comprehensive evaluations. So Anupam excels in synthesizing evidence for learning initiatives in projects, portfolio, strategy development, and executing research studies. She holds dual master's degrees in population studies from the esteemed International Institute of Population Sciences and health management from the renowned Institute of Health Management Research. Strongly driven by a personal mission to improve return of investment in monitoring, evaluation, and learning, Anupam is passionate about making evidence accessible, palatable, simple, and usable by all. So we're looking forward to learning from Anupam and what she and the team at AIF have been doing. I'll immediately hand over to her, and then I'll get back to you after the presentation. But before we get started, as Lindo mentioned, we do have a poll that's going to be running. And so I will start the poll. And once the poll is started, as you go through this session, just feel free to respond to it. Feel free to use the Q&A if you have any questions along the way. We will have an opportunity to respond to those questions later on during the session. Okay, Anupam, please take it away.
Thank you so much, Morphe and Lindo. It's a pleasure being here. Good morning, good afternoon, good evening. I'll just start with saying that it's an absolute honor being part of this webinar. At the same time, it's a great learning opportunity for us at AIF, and we are strongly committed to learning new and innovative ways of scaling technology as a solution, as a means for serving the communities, whether that's as a data collection or even as a tool for communication. So as much as I'm happy to present the findings or the learnings from the work so far using SurveyCTO, I also look forward to hearing from you. So please do use chats and comments as much as possible. Without further delay, I'll quickly share my screen. So in next 20 minutes, I understand we do have people from diverse backgrounds. I'll try and cover the use of SurveyCTO in a social programming, in a maternal and child health programming, clearly talking about the contours of data collection, the whole frameworks that we used in that particular program, and how did we use SurveyCTO as a medium for collecting and analyzing that information. I'll touch upon the boundaries of maternal child health program as a technical, but I'll try and balance it out with saying what did we use with the technology rather than the technical aspect of the project programming itself. But all the questions are welcome. I lead the Learning Evaluation Impact Unit at AIF, American India Foundation. The unit is responsible for collecting data, evidence, and supporting and monitoring of our programs across the verticals of health, livelihood, and education. Leadership is one of our flagship programs as well. So in the 20 minutes, we'll be talking about AIF, then the In Focus program of Maternal Newborn Survival Initiative, MANSI, which is used as a case study. I'll be talking about a very specific project that is done under that particular vertical. And then we'll quickly jump into the monitoring framework that we developed for the program. How did we use SurveyCTO? What has been the experience and learning so far? And based on the inferences, how do we use SurveyCTO as a scaling solution for monitoring in nonprofits, which has always remained a concern due to the resource constraint, but also the return on investment. What do you get out of investing so much in a data collection? A quick update about AIF. We do work across 11 SDGs, that as we call them. But in the Sustainable Development Goals, we primarily look at improving the lives of India's underprivileged, with a special focus on women, children, youth, and other vulnerable communities. And our unique proposition that we do is a broad engagement between the communities, civil societies, which is working towards building a lasting bridge between US and India. It's an organization that came into existence at the backdrop of 2001 Gujarat earthquake in India, where the two governments came in, and they used this as an opportunity for humanitarian support, but also later on took it as an advantage of a cross building, a bilateral relation between the two countries. How can we continue to strengthen civil societies and cross sharing the best practices between the two countries as we move forward? We do have our operations headquartered in India, in Delhi. And till now, from our work across the four verticals, we have touched upon 16.51 million lives across 36 states and UTs. In fact, we are, through our new innovations, we are reaching out to the deep rural areas, to the unserved geographies as much as possible. That's the intent of AIF. Quickly talking about MANSI as a program. It's one of our flagship program under the public health vertical. The program is designed to reduce maternal and child mortality. That means saving both the mother as well as the newborn baby. But how to do it in settings in rural areas or in remote areas where there's very limited resources, untrained providers, or there's a dearth of proper facilities and amenities in there. So there's a life cycle approach that we continue to use. We bring in community-based innovations to come up with local solutions. We do have a community health worker, a frontline worker called Asha in India, who is mandated by Government of India to provide family planning and maternal health counseling and support to women, help them deliver, help them take to the facility for safe deliveries. We do work with them and other frontline workers, build their capacity so that we can ensure every woman has the right to have a safe delivery, and both the newborn as well as the mother have a good health outcomes. In the MANSI program, we also provide a continuum of care, so which means we use the entire life cycle approach. We do look at adolescent girls, the mothers, pregnant women, lactating women, children up to age of 5. And till now, through our programs, we do aim to reduce the newborn mortality, that means the neonatal mortality, by 50% across 7,000 villages in the country. Within this MANSI program, as I mentioned, if you look at the outer circle, the kind of interventions that we do is we build capacity of the front lines. We do a behavior change communication with them so that they are able to talk to women, tell them the information, but also try and prepare them for the delivery. There's a very gender-centric programming because all of us understand the differential behavior when it comes to women in the vulnerable groups. There's a continuous monitoring and evaluation support that is provided in the program. We use digital health innovations to talk about how we can maximize our reach and coverage of pregnant women, adolescents, children under 5, as well as the lactating women and caregivers. The impact so far, we have reached around 350,000. So 350,000 pregnant women have been counseled so far. And the same goes for newborns. I mean, this number keeps on increasing. This just to give you an idea of quantum of data that comes in the program per se. Today, I'm taking a small chunk of this program. Within that program, we do have a project which I'll be using today as a case study. The project is on advancing nutrition for improving maternal, child, and adolescent health outcomes. The focus area on that program is to improve the behavioral outcomes. That means to change to change the behavior of pregnant, lactating caregiver women and adolescents to help them adopt healthy practices, which means it would require multiple rounds of interaction with these individuals and multiple level of activity in the community. The success metrics of that program is largely in terms of reducing anemia, reduction in underweight among pregnant and lactating women, as measured by the body mass index BMI, which requires measurements of the height and weight. reduction in the percentage of undernutrition, both for stunting and wasting among under 5 children. So the monitoring data that we largely use in the program, one is because it requires a clinical intersection. It also requires a lot of healthcare services. The need assessment that needs to be done in the facility and community level before we start the program to understand what kind of gaps are there in the current system and how can we use some of the existing opportunities for building it up for the program. The second data that where we use SurveyCTO was in terms of the repeat home visits. As I said, these are behavior changes we are anticipating in the program. It required us to reach a same individual, whether that's pregnant women or lactating women or adolescents, at multiple points of time, so that you are continuing reiterating the same message. The third was the BMI biomarkers, which means the height and the weight in terms of the HB level, the hemoglobin level testing, to understand what has been the change in the prevalence, manifestation of anemia or underweight in these particular communities. And then last was the knowledge attitude practice survey that we continuously do in the program. For all the monitoring data units, we did use SurveyCTO. Just quickly going into the kind of tools that we just discussed. So in the need assessment, it required developing forms on the facility infrastructure, consumable supplies. That means the kind of form formats that we had used had multi-layer questioning in it, but also in terms of capturing intriguing information at multiple points. There was also training and capacity building formats. So there were formats around the inventory for past 6 months, but also formats about the training that has happened in past 1 year. Home visits, which is part of the regular monitoring data. Multiple visits were done for the same respondent. So how do you continue to track the pregnancy over the gestation period? How do you continue to track data or collect data on the exposure, the program exposure that these particular individuals have received over a period of time? It also required us to bring in some insights from the previous visit so that when the frontline worker is going there, they are able to talk about the messages or look at the messages that were given in the previous visit, which becomes utmost important when it comes to pregnancy, when it comes to lactation, because there's a series of messaging that is required. In case of breastfeeding or diet and nutrition questions, we need a repetitive behavior. And this is reinforcement of messages that is required. So while the health workers are carrying the flashcards and the flip books with them, how do they remember that this woman has already, or this particular target group has already gone through particular messaging, was answered by the monitoring format that we created using SurveyCTO. Biomarkers, as I mentioned, it required large-scale data collection sample survey using a standardized methodology. There were separate modules in the form for the target group. So there was a general section that was across the various respondents, but then based on certain parameters, there were filters that are there. So how do you design that in the SurveyCTO with various beneficiaries as various modules? And then the knowledge questions, attitude questions, which do have filters, and the other means of verifying and validating data as you continue to interview the respondent and enter the BMI measurements. We have been using SurveyCTO since May 2018 for collecting monitoring data, assessments, internal evaluations across AIF programs. So across even livelihood and even in education, we have used a lot. In this particular project, we have done 120,000 entries till date. This is the second year of the project. So you continue to reach out to these individuals at a multiple point. Now, our experience says SurveyCTO as a data collection, the points that we worked. So the data flow was very clear on the right side, the flow chart that you see. There were field teams who were filling in formats, MIS formats, initially before adopting SurveyCTO in in an online data or in a paper-based data, which was again entered into Excel or Google Sheets. It was sent to our project managers or project leads, which were aggregating data and they were sending it to us at country office, and which we were using for dashboard creation with for our global office review. However, when we saw SurveyCTO, we started looking for solutions for real-time data collection. The points that worked in our favor for choosing SurveyCTO was the user-friendly interface. I think it's a great advantage that the platform comes with a multilingual abilities. There's a digital literacy divide by gender. So we do have field workers aging from right 25 years to even 45, 50-year-old. So this app has to be something very simple, or form has to be very simple that can be easily filled by a 25 to a 50-year-old. So that ways it came on really handy. The kind of forms that we have to develop, it was easy for us. There was a mobile application function, which means that we don't have to give everyone heavy devices to carry it, or it did not require a static site. The handset compatibility, as all of us know that people in the field have different generations of handset. We were looking for a platform which is compatible with most of the generational handsets that people are using. Easy form designing with advanced logic feature, because that time we did not have a specialized IT team, or we don't have technology background people who can do coding, intensive coding and all. We wanted something which is simple for our team, where they can develop in-house forms and formats. So that feature comes in really handy. The offline feature for remote connectivity. We still work in geographies where we don't have internet connectivity. How do you ensure that you collect information, you collect data in there? How do you ensure that the moment it comes to the network, it syncs in? Was another great feature that we use in SurveyCTO. Data security and confidentiality has been great. We are able to maintain the due diligence to all data security formats because of the ability that it does encrypt the data wherever required. We also have led a lot of HR surveys using SurveyCTO, where the data is not, is sort of bound, encrypted in a way where it's not seen to us as well while administering the tool. So it ensures that confidentiality. There are periodic software updations and maintenance. So there has been very few times when these software updations happened when we were in the field, but there's always a prior intimation that comes in. The users tech support. You always, whenever you buy one such platform, even internally, team requires a lot of hand-holding support post taking a subscription. Having a community of like-minded users where you can post your queries and they give you a real-time resolution and solutions of trying out. That was super helpful for SurveyCTO. And yes, we do have Maulik there, based in India, who has been a great support. So we continue to talk to him whenever we have faced any challenge. The real-time monitoring of data was a positive, and the ease of retrieval. You don't have to complete the survey to download the format. So you can see the progress of the survey simultaneously is a great feature. Scalability and expansion, because it requires limited training, minimal training. The formats are easy to follow. It's easy to scale it up. And we were able to scale it up from 1 site to 3 sites. And now it's in the 4th site execution because of the feature of simplicity. The experience and learning so far, I really want you to look at the picture on the right side. It's a middle-aged woman who is using SurveyCTO in a tab, is trying to fill in, but the funniest part is she's still carrying that register and pen. So how to work with the field workers who are really in the older generation, who still don't trust the technology and are not able to latch on in it as quickly as the new generation. So that required continuous regular capacity building workshops for the field teams. And all of us who are on the designing side have to accept the fact that it does take some time for the behavior change to set in, from transitioning from paper to the online mode. There would be times your field teams will be using both. Rather than saying tomorrow I go complete paperless, give them that time to see that their data is saved and they are able to retrieve it. There are many times in the initial phase, we were getting these calls that I can't find my data. I did 20 entries. I can't see it. All those panicky calls. We have to understand from their logic and build in the trust in the technology. The second experience was the beta testing and periodic checks. Many a times when we start testing it at our end, it might show everything right. But when it starts rolling out in the field, given the kind of devices that they are using, or there could be a memory issue or cache layers, especially in the offline formats. It requires to have periodic checks. So it's not something that you just simply let it go in one. There has to be inbuilt data quality assurance mechanism. Once the field worker enter the data and submit it, then it's difficult to change it because it goes in the memory. So how to build in that check where the supervisor is able to look at the quality of data before it's submitted. The learning, mapping of villages. So in this case, should you go and enroll everyone in your program on day one in SurveyCTO, or you start listing as they go? That is a crucial decision, especially for projects which do a longitudinal data where they keep on meeting the same individual over a period of time. And I guess that's a trade-off that goes to cost versus volume. Do you have sufficient resources or not? Formulation of unique IDs. It's a very tricky question, and I know that we went through this in a very hard way learning. What are the variables to consider? Can I use the first name of the respondent and his or her spouse name alphanumeric unique ID? And we realize it doesn't, because there are many times in the same locality, I have two individuals who might have similar kind of names. So it becomes a primary identification for your data source, especially in the repeat visits. Documentation of iterations. People just forget. You have transitions in the team, people go at the back end, they change the form without writing why this particular changes were made, and which disrupts the data entry in a logical flow. So you're not able to match two files together. So how to ensure that there is a periodicity, there's a rationale for making changes, but there's a detailed documentation of those changes, which remains as a reference for the future point. Another learning is to invest additional time in designing the detailed monitoring information system, the MIS for the program at the beginning of project. Often people who are there in the social sector and development programs with here would agree that we get to see the broad contours of a project when we start working. But there comes a time somebody just comes in and say, why don't you collect 10 more data sources? There are 10 more data points here. So rather than disrupting the whole MIS format, the monitoring form at that time, invest that time initially in the beginning to design and talk about how many information will you be collecting throughout. That helps us in maintaining the standardization. The last learning, which is very important, is how to include the subscription charges in the funder's budget. Eventually, when you start using this monitoring data, you should be able to show the investing parties, the donors and the funders, of what importance is it to invest in this particular platform for monitoring data. Many programs do not have budgets for evaluations. How do you know your program is success? Do you want to only wait for the survey to tell you, or do you want to see it from the monthly trends? That's the negotiation that we started having at AIF, and many conservative donors started listening to us when they saw the data improvement. Then they were reviewing the program on a monthly basis. It doesn't happen overnight, so I would say have the patience, but every donor wants to see the progress of the project. So why not they invest in some? SurveyCTO as a scaling up solution for nonprofits. I think it's a great solution for scaling up because it works in offline and is helpful for community intervention in remote areas. If you look at the right side, it's actually a very remote community that we covered in Madhya Pradesh, Chindwara district. So how to go in such settings and continue to collect data and information as you go. It provides data in both the long and wide formats, which is super helpful in tracking beneficiaries that are covered in repeat interventions. I don't have to reject the data. It's easy for the team to work on, but it's also easy to train the field teams to start working. Periodic trainings and workshops are definitely required for strengthening team capacities in recording, retrieving, and analyzing data. But there has to be some sort of an annual budget that needs to be allocated for the spokes. So we do take it as very sincerely annual trainings for our teams on SurveyCTO, especially for the spokes. Cost effectiveness is a trouble for smaller projects. But what we have done is we have started clustering projects which did not had a monitoring fund separately. We started clustering formats And we reached out to all those 2-3 donors together, and we said, this is what we are investing in. We'll put 1/3 of money in you, rather than putting it on the one. So how can we continue to collect some basic information to see if we are going in the right direction? One additional feature that I see should be added in SurveyCTO is it does help you export the data in Excel. It does help you export the data in CSV. But what if there's a possibility of exporting it directly to an analytical dashboard? I don't know. I look forward to hearing from various people, but I just believe that the data set, when especially when you are working with the program teams, if they are able to visualize the change, it becomes less daunting for them, and they are more receptive to the kind of change that is happening, and they start investing in the data quality issues. I just want to acknowledge it would not have been without the help of the program directors or the leadership team. The investing in monitoring systems is always going to be costly. It would be seen as something that we are improving quality of our programs, good to have, but it has a very high return on investment. It not only helps you establish the credibility of the work that you do, it also becomes a tool in your hand, which you can go to the new funders and talk about it. But you can't do it unless you don't have a support from the leadership team. I also want to acknowledge the implementation team, all the field teams from right from the project leads, block supervisors, portion sathis. How do you clearly lay out to everyone, do repeat training of everyone, understand their whole mechanism of involvement in the project monitoring when it comes, and be comfortable with the tool in hand, which in this case is using the SurveyCTO platform. Hats off to the trainers and programs point of contacts. In my case, these are 3 individuals, Ajay Rajpal, Srinivas Bittu, who have been working with the various project teams relentlessly and telling them that this is how they can help. So they also understand their requirements and build in forms and formats accordingly, which means that they don't rely on one individual to develop the forms. The knowledge is institutionalized in a way that there are multiple trainers who are available in the organization, which safeguards us from any unexpected transitions. And then the evaluation and impact team, I want to especially call out Dard Harsh, is my ex-colleague at AIF, but it's usually requires a lot more to go and explore such kind of online solutions and see what works best, rather than just being comforted with a Google sheet or a offline data. Our donors for investing, and Maulik and Treem and Trestle for helping us out. I just want to thank all the listeners now. I've tried to balance it out given the time I have. Thank you so much. But as I said in the beginning, at AIF, we strive to learn from our great partners, incorporating sectoral best practices into our programming. The intent is to optimize the impact of our initiatives and actually effectively serve the communities that we all engage with. With this, I want to thank you all for listening to me and open to questions and discussion. I've mentioned my email ID. We do have responsibility at AIF to continue building it. So please reach out to me if there are any questions related to the experience that I shared or the project intervention. We'll be happy to support you. Thank you so much, everyone.
Thank you. Thank you so much, Anupam. That was quite an interesting presentation. I think covered quite a number of things, but I think they were very, very clear. First of all, in understanding what exactly the work you're doing, the work, how you are using SurveyCTO in that particular work, and basically the things that you're learning from that. Thank you so much for that. Yeah, so we, whilst you were making the presentation, we had a poll running. And in that poll, we're basically getting a sense from the people in attendance here, firstly, sort of how the size of the projects they work on, whether it's based on the number of subjects, all the questions. I think you mentioned that you have gone, you've gone through about over 120,000 forms, which is quite a lot. But clearly, I'll just end the poll here so that everybody can get a sense of what the results were. You clearly have quite a number of people who share sort of that level of scale. From what I can see here, we were asking, around 3,000 subjects. You've got only 4% basically work with lesser numbers than that. It applies to most of the people who are listening to this. And then we also can see that over 73% of our attendants are collecting information from the same recipients over a period of time. So again, they do relate to the work that you are doing. So hoping that everybody has found this this useful. We'll get to questions. Again, if you have any questions based on the presentation, there's the Q&A tab that's there. Type in your question there, and then we'll get to it. But before we get to those questions, I just wanted to ask a couple of questions from my end, just to emphasize some of the things that you've already mentioned. So in your presentation, you touched on the importance of regular and periodic capacity building for the field teams. I was wondering if you could just share some examples of the challenges and issues that these teams typically would face in the field, and then how you would normally go about dealing with them. I'm pretty sure there are a number of people who can learn from that. So please go ahead.
Definitely, Moka. I would say one was the age. I said our frontline teams are aging from 25-year young person who has been using Insta and LinkedIn on their mobile phones, even in the rural areas, to a 45, 50-year-old who literally looks at the key when she presses it. So that's a wide variety through which we worked. So how to make a person comfortable with the technology per se, who uses mobile phone only for calling, say. So how do you build the capacity for entering data and information and not being anxious about that I've lost it somewhere? So that requires a regular motivation. That was one challenge that came in, because in an online format, once you submit the form, it doesn't show up as where did it go in the system, while in a hard copy it's always there in front of you. This was anxiety among our field workers right in the nascent stage, as in, will I get to see what I filled in? So that was one challenge that we looked at, and the way we addressed it is constantly reassuring, but also showing them the background data. So whenever there's a training happening, we ask them to do the user testing there only, and then we open up the background to say, see, this is where your data is. It requires a constant reassurance, and it do take time. The second was the transition in the team. While we do train one batch of people, there's always a time in a multi-year projects that there's a regular transition that happens. People contract comes to an end. How to build in that kind of a regular training intensively, so that people who are going out in the field are not filling it by themselves, just asking it and filling it. That we tried and counter through creating a cadre of trainers. So we do have, I named the three people who are the primary spoke, but each program we do have our different staggered trainings that happens with the individual. And usually they are supervisors who are trained on data entries, not in terms of the entire exhaustive SurveyCTO. So the trainings are very customized to what is your role in the program, whether you are a data entry person or you're data aggregator or you are a person data analyzing. And the trainings are customized to those needs, because the frontline worker does not need to know how to develop a form. At the same time, the person who is developing the form needs to know the entire programming to the ground. So that's being mindful. We created regular cadre of trainers. Data quality was another challenge. People fill in something, they submit, and they suddenly realize that there was some wrong information. So they fill in another form for it, correcting that information. So how to bring that in? So there's a regular data quality, data cleaning that used to happen when we were presenting to the donor. Over the period, we realized that we have to build in certain checks, but also identify who are the individuals who were sort of more prone to making these mistakes. So how can we build their capacity and handholding support? Last, when we started SurveyCTO, and I completely agree with one of the questions there, as like, how did you build in the cost that is required? So we had to persuade our leadership team to invest in the subscription costs. Ask our donors. So we do have a base of US and India donors. So ask our donors who do believe in technology to pick up that subscription. So initial challenge was who will pick up the cost, but we make sure that we build in a component, engagement component, right from day one, so that we ask our donors to start picking up the cost for the data that they're collecting. So there's no cross burdening that happens. So those are certain challenges that we came across while training and using SurveyCTO, just rolling around in the field.
Thank you, thank you. That's really interesting. Talking about that range, that wide age range. You've got those that are very familiar with smartphones and those that are, I think in my country we refer to them as BBCs, born before computers. So it's always that reassurance and sort of the tips that you have for reassuring them sound like very useful tips for others to be able to work with. I'll just ask one more question before we open it up for everyone. So you have this multi-year project and you have a number of interactions with your respondents. Obviously you have a large volume of data that's coming in, and so you need to figure out how to manage that data. What data management advice would you have or would you share with organizations that face a similar challenge, sort of just dealing with this large volume of data?
I'm going to talk about few failures that we had in the initial round, because that's where the learning came from. But I think honestly, when we started doing it, one of the data management constraints that we have was we started with 10 data points, and suddenly someone said, why don't you collect two more? Why don't you collect two more? So the form kept expanding. So I think the first tip that I would say is invest in that process. A program cannot continuously expand the monitoring formats as it goes. It can't. If you have the same result, I'll just draw an analogy. If you are baking cake, then the recipe has to be the same, and you need to know the ingredients right at the beginning. So the same goes for a project. You need to put some time and effort sitting with the program team, understand the data points that are required, and standardize the formats. That takes up a lot of load from the teams. The second is the access control, the back-end access control. You have to ensure people, they are selective people who do have back-end access control to change the forms and formats. So if you have multiple users who are doing it, chances are there are a lot of changes that happen at the back end. And it happened with us that one person who was handling it at the back end suddenly realized there was some translation error. The person corrected it innocently without realizing that it disrupted the entire data programming progress. So how to make that control, the access control, very clearly, and have intensive user training for them. Documentation, as I mentioned, many times we don't know who changed. We can see in the history, but we don't know why it was changed. Any software, we have to understand that it needs to have a proper version control documentation, which tells anyone who is using it as in what has happened. Unique identifiers, as I would say, it has been my biggest learning. And I would say Maulik and team, while they worked with us, this was the most interesting identification for us, because in other softwares, we do use alphanumeric unique IDs for analysis. So when we started realizing the pattern here, that's where it became tricky, and we realized we have to come up with different kind of code. So one clear unique identifier that identifies the individual as you continue to develop multiple forms. There has to be some archive formats for the past data. When you continue piling it up, at some point, it does require you a different arrangement, or it does start slowing up my process at the back end. So how do you make sure that you do have an archiving system for the past data? You analyze that, you keep it with a separate format. For us, it's a every year exercise. So we don't let it accumulate over a period of time while it's there on the server. At the front end, what we do is we do archive data so that we have definite findings for the year. So those are some of the ways how we ensure that we are able to manage a massive scale. Yeah.
Oh, wonderful. Thanks. I think that's very useful and helpful to learn. I think these are sort of generic thoughts and plans that you need to have as you are dealing with a lot of data. And I'm hoping that others who are listening to this are able to also pick up on some of these best practices and really implement them for their projects. Briefly, I think you touched on this just now in your response, but also you touched this earlier in your presentation about your preferred or your wish list regarding SurveyCTO, which included, I think, connection to analytical tools. That's really, really great. I like how you put it, the way you phrased it, in that idea of being able to connect to analytical tools, because they are really great analytical tools that are available. For those that might not have explored SurveyCTO before, we do have a number of ways in which you can actually connect to tools. I think Anupam referred to being able to export to Excel, but we allow you to automatically push submissions to Google Sheets. And then we have, for those that use more specialized tools, if those tools have an application programming interface or an API, we have an API that allows you to push data to them. And so if you work through some of our support articles, you'll find things like connecting to Power BI or using a generic connector like Zapier. We like Zapier because it allows you to connect to so many other different tools. SurveyCTO can automatically push things to Zapier. And if you go to our video library, you'll find a video there on what we call SurveyCTO integrations. It has guides on some of those. So if you're exploring that and you have a similar desire with Anupam, look at that video. If you find what you're looking for is missing, you can feel free to engage with us, and we can see how best we can support that or work around that. But I know that's a very, very important part of the workflows that we have. Thank you so much, Anupam. We do have a few questions that are in our Q&A. I do want us to get to those particular questions. But before we do that, I just want to remind everyone that if you have never used SurveyCTO and you're here, you can always start a trial server, reach out to our sales team. On the screen there, you'll see an email address to Maria. If you reach out to her, she'll help you get started. For those of you that are using SurveyCTO and have questions, even like what I've just talked about in terms of integrations, we have a 24/7 support team that's available. Write to us. We'll be willing to engage with you, see how we can help you. And if you're not on a paid subscription, we have a community subscription. If you're on the community subscription, there's a community forum. Again, you can reach out through that, and we'll be able to help you even there. And as always, keep posted on our social media. You'll be able to see any updates that we have.